Mental health service providers here in Green Country have major questions after they were given notice that their contracts were set to be terminated. News Channel 8's Lauren Henry joins us live with an update and some clarity on this situation. Lauren.
Well, Brenna, here at Grand Mental Health, they provide services to thousands of people, and the CEO of Grand Mental Health tells us that since receiving that notice of contract termination from the OMES, they have many questions, but they're not getting very many answers.
Before receiving the email on April 10th, we had no previous conversation about this. Virtually out of the blue, we received that correspondence.
What Grand Mental Health CEO Josh Cantwell is referring to is a notice of contract termination set to take place on May 10th. It was also sent to Creoks and Family and Children's Services, but Cantwell tells us that they're still waiting on answers about what this means or if it was meant to be sent in the first place.
We've had some good communications with the Oklahoma Department of Mental Health and Substance Abuse Services, who's been very clear that this went out erroneously, but we haven't received notification from OMES that this was a mistake. For us, the most important thing is that there's just no disruption in services.
We reached out to the Department of Mental Health and Substance Abuse Services. The Commissioner, Ali Friesen, told us in part, quote, "We understand the confusion caused by recent events and are working closely with OMES and our community partners to implement a contractual stopgap. This issue is entirely unrelated to funding gaps or contract optimization."
I'm hoping that there was simply some miscommunication about perhaps the timing of these, what the plan is moving forward. There's certainly an expectation and a hope that we continue to deliver mental health services in the greater Tulsa metro area, certainly through the fiscal year.
Creoks told us in a statement that they are also working with the Department of Mental Health to find a path forward, but day-to-day operations have not changed. As these organizations wait to learn more, Cantwell stresses the importance of providing these services to the community.
We're talking about people that won't receive treatment, that will die of overdoses. We're talking about people that will die from unmet mental health needs. And we're talking about people that will continue to get sicker and move further down that path because there's no intervention.
And Cantwell tells us that they will continue business as usual here at Grand as they continue to work to learn more about how to move forward. In Tulsa, I'm Lauren Henry, News Channel 8.